how do we democratize medical fabrication? You know, we hear a lot about whether it's patient engagement or doctor engagement or increasing the communications. We fundamentally believe that medicine is about being tangible. Human beings are very much analog, even though we're surrounded by digital media. An app cannot fill your IV or give you a bypass or turn on a nebulizer. Medicine is still very much something that, even though we have all the information in increasing forms, we still have to have hardware and tangible devices to make you better. And unfortunately, we've had a long history of designing medical technologies that are really black boxes for health. And what we're trying to do is go from black box design to building block design so everybody can play.
And how exactly does the lab seek to do that?
So we look at unconventional prototyping methodologies. We find people who are already making their own medical technologies or devices or approaches, and we find out what makes them tick. And we've developed a methodology where our goal is almost to put us out of work. Like, we don't want to be the designers at the heart of every single device we make. We get more excited when we get a call from somebody and say, tells us, this is what we made today, now what? Because that means that that person is now empowered and can go on and do more things.
Can you tell me more about your latest initiative, the Maker Nurse Initiative?
You know, everybody hears about the star doctor who invented some sort of catheter in their garage and went on to found a medical device company, or a surgeon who's now had a procedure named after their name or something like that. But we never hear about nurses. And in our work internationally, what we found when we were going out to look at these MacGyver inventions and just everyday innovators, was that nurses are the most courageous ones, but they're also, unfortunately, the most quiet ones. And so there's social dynamics at play, there's the role of what a traditional nurse is at play, yet they've invented a lot of things, and they keep on creating and fabricating a lot of things. So with the support of the Robert Wood Johnson Foundation, on Saturday we actually launched a nationwide initiative to go out and find what we call maker nurses. Nurses that are fabricating everyday things in the hospital. We want to understand what makes them tick. We want to figure out what tools and methods we need to create for them so that they can keep on doing it. And hopefully a nurse will be also known from transitioning from a healthcare provider into a healthcare fabricator and inventor of technologies.
What sort of project ideas have come out of this? Are there any that have been turned in yet?
We're doing a historical analysis of what's been happening. And when you look at the history of nursing in America, and you take a scan through journals like the American Journal of Nursing and that sort of thing, the beginning of the 20th century, nurses were turning in ideas every week to these journals and things that they had already built. And then something happened around 1950. We don't really know what it is, where that's part of our project. And it just, the submissions just dropped like a cliff. And so we know that they haven't stopped doing it, they've stopped telling people. So when we reached out, we heard from people that were making quick surgical adapters for neonates. They were actually part of a hacker space in New York City.
Wow.
They had ideas of how to modify IV lines. Lots of different things like that sometimes we would never ever hear about.
And what do you hope to get out of MedX this weekend?
There's so much focus on patients, and there's so much focus on like how do we engage them. And one of the things I want to understand is how much of that engagement is in data. There's a lot of talk about data. How much of it is in actual participatory design, and how much of it is, we're looking to meet other people to understand at what level are we engaging the patients, not just by listening to them and being expert listeners, but by giving them the tools to do what they need to do.